Hello, everybody, and thank you for joining us tonight. Before we get started, I'd like to read this brief disclaimer. And the disclaimer is this: the PharmAssist virtual learning experience, brought to you by Mandel's Clinical Pharmacy, is intended only as an educational program for patients. Any clinic-specific information shared by the nurses is the opinion of the nurse and is not intended to replace the recommendations or requests of your healthcare professionals. All medications will be dispensed by Mandel's Clinical Pharmacy according to the prescription as written by the provider. And with that out of the way, I would like to introduce myself. My name is Craig Orpello, and I will be your host tonight throughout this PharmAssist program. And what is the PharmAssist program? Well, the PharmAssist Virtual Learning Experience is an educational program created by Mandel's Clinical Pharmacy to bring you together with outstanding healthcare professionals right from the comfort of your own home, especially now that it's getting cold and some of us are getting hit with snow. So this is even better. PharmAssist takes place every Monday at 7 p.m. Eastern Standard Time. And tonight we'll be providing a live medication instructional program on 3 common fertility products, including an interactive Q&A throughout the program. And that's where you come in. You can join us via Zoom or Facebook Live, and you can be a part of the program and part of the discussion by sharing your questions, whether you're in the chat with Facebook Live or in the Q&A or the chat on Zoom. So what we always have here is we're joined by a various amazing HCP each and every week from across the nation to provide you with a real world experience just for their whole goal is to make it feel as if you're sitting right there with them and you're right there at the clinic and you can ask those questions just like it was your own personal appointment. And so today we are joined by Laurel Meier. So I want to thank you again for your time and interest this evening. And now I would like to turn it over to Laurel. Take it away, Laurel. Thanks again.
Hi, my name is Laurel Meier. I'm an IVF case manager in California. Been doing this job for about 15 years, and I absolutely love it. So tonight, we're going to be going over 3 medications, Menopur, HCG, and Ovidrel. We'll have a Q&A after every video. So I encourage you to put in your questions because any question you have, someone else is going to benefit from that too. And then when you do ask your questions, just focus those on how to use the medication, how to inject it, the side effects, and the purpose, and direct your specific clinic questions about dosing and timing back to your IVF nurse. So this program, when it is concluded, it will be available, as always, on mymandelsPharmacy.com. All of these programs are available at any time. You can watch them. You can pick a specific medication and just watch that video on that medication, or you can watch a whole program. That's completely up to you. It's also available on Facebook and YouTube. So to get started, I'd like to share a story of why I became interested in becoming a case manager and why I wanted to invest my time and energy in this program. So about 25 years ago, my husband and I started having trouble getting pregnant. I wasn't having regular periods, so I knew I wasn't ovulating. His semen analysis was fine. So we started with the first-line treatment of Clomid. We did this several months, didn't work, didn't ovulate. So then the next step was doing IVF. We found that I had a blocked tube, so I had to go on to IVF. We did a couple of cycles of IVF, unfortunately without success. And during the time that we found out that our last cycle did not work, we actually got a call from a very good friend who was a labor and delivery nurse, and she had a patient who had just delivered and wanted to find parents for her baby. She told her patient about us, and her patient wanted to meet us. And we were, at this point, very ready to adopt. So we were thrilled. We went and met her. After a long discussion, she decided she wanted us to be her baby's parents. So we brought our little girl home on Valentine's Day. Then fast forward 3.5 years, we were the happy recipients of an adopted embryo or a donated embryo that was transferred to my uterus through a frozen embryo transfer cycle, and I got pregnant. Delivered my second baby girl on the 4th of July. So it's just been an amazing blessing going through this process. It's been frustrating and difficult, but I loved it. And I just wanted to share my story real quickly just so that you would know that you're not alone. These are my girls now. They're 16 and 20. I also just wanted to let you know that you're not alone. I mean, I did this a long time ago, but right now there's thousands of people just like you going through IVF, going through infertility. And it's important to just remember that you're not alone. And if you can reach out to friends and family and talk about what you're going through, that can be very helpful. I encourage you to just take it one step at a time, one day at a time. Stay positive and keep the faith that you will build your family. You will be successful. If I can do it, so can you. So another program that has just started is called Behind the Shots. Mandel's has done a more extensive story on my fertility journey, as well as other people's. And you can watch this. We're going to be posting a link so that if you want to hear my story and all of its gory details, you can watch that later. So tonight, my goal is to help give you the courage and the strength to give yourself your shots. And I know it's going to be it feels very daunting in the beginning, but by the end, you're going to feel like a pro. So the first video is on Menopur. Hi, my name is Laurel, and today I'm going to demonstrate how to mix and give the Menopur. Menopur comes in little powders, and we're going to use our imagination, and we're going to pretend that there's little white discs of powders in these vials. You'll also need a container of saline, a Q-cap, which is a needleless mixing device, a 3 ml syringe, and a small needle for giving. So make sure you have all your supplies ready. And the first thing you're going to do is take the caps off of your supplies. Now, some clinics are going to order for you 1 vial of Menopur. Others will give you 2 or 3. So just follow your clinic's instructions on how many vials of Menopur. Each vial is 75 units of medication. So if you're told to give 150 units, that would be 2 powders. You're always going to be able to mix this Menopur and give it as 1 shot. So the next thing we're going to do is to peel that off. The Q-cap will go directly on the liquid. Just pop it on and take the plastic covering off so it looks like this. Then you're going to take your 3 ml syringe and you're going to put 1 milliliter of air in the syringe and you're going to twist it onto the Q-cap. Now, keeping it on a hard surface, you're going to push the air in and invert it. Draw up 1 milliliter of the liquid. So you go a little past the 1 and you push the air out until you're right on 1. Pull off your liquid and put it to the side. Now we're going to pretend to mix the powder. So here's the first powder. You push the Q-cap on, you inject the liquid into the powder, and you swirl it very gently. This powder will instantly dissolve. Now, if you have a second powder that you need to dissolve, you're going to push the air in while it's inverted, pull everything back into the syringe, take the empty vial off, put it to the side, and then do the same thing with the second powder. Push it on, inject this into the powder. It will dissolve immediately. Swirl a little, turn it upside down, push, and pull all the liquid back into your syringe. Now, when you're done with all of the powders that you've been told to inject, you're going to twist everything off while you're still pointing your syringe at the ceiling. And you're going to take your small needle and you're going to add the needle. The needle goes on like this. Twist it on, pull the cap straight off. And now it's time to get rid of that air. So just push until you see a drip of liquid at the tip. And you're ready to give your shot. So this is given in the abdomen. Pick a spot, stay an inch away from the belly button. Don't inject into a spot that has a bruise from a previous shot. Anywhere you can pinch some fatty tissue, just give it a pinch, inject straight in at a 90-degree angle, let go of the pinch, inject your medication, wait 3 seconds, grab a Kleenex, pull out, and hold with the Kleenex. After about 10 seconds, check your skin site. If it's dry, no bleeding, you're done. If it's bleeding a little medicine's leaking out, just keep holding it until it's dry. Everything goes in a sharps container, and your next shot, you're going to get a whole new supply. That's all there is to it. All right, so that's Menopur. Any questions come in, Greg?
It's going. All right, perfect. So as you mentioned, you can put in any of your questions into both the chat or into the Q&A section, and we will get to them all. And the first one that comes in here is basically just a kind of storage question. So it's one of the ones I know you've covered before, but it says, how do I store my Menopur between doses? Is it affected by the cold weather when shipping? So that's obviously now, right? The Northeast is being hit by a storm this week. So people really want to know, how do they have to worry about that?
Yeah, good question. So Menopur should be stored under 77 degrees. So you can store it in the refrigerator or you can store it in the cupboard. That's up to you. It is not mixed until you're just about to give it, so you don't need to worry about that. As far as the shipping, it's not going to be any problem. It doesn't need to be shipped in any kind of a cold pack, but it can be. It can be in an insulated pack. So I would be home to receive your shipment because if it is sub-zero out, you do want to get that off of your front porch before it gets too cold.
Awesome. Thank you very much. Great answer. And I know that's something that comes up all the time, and I'm sure it'll come up with some of the other products as well, as people trying to understand the kind of, the minutia of making sure that you keep your medication safe, because it is expensive and you want to make sure you know what you're doing with it. And that is one of the reasons why, and I know we talked about it on the last one, but we always recommend that people, when you get that box, make sure you open it up and go through and take a look at everything in there so you know what needs to go where, what needs to be stored where. And it allows you to really, no one wants to have that moment right before you're about to give the shot, trying to tear open the box and figure out what's in there, right? That's a bad move. You want to make sure you give yourself some time. So thank you so much for that. And now going from a very specific question to a much more broad and open-ended question, we have this one that came in that says, what does Menopur actually just do in my cycle? Why did my friend do an FSH cycle alone and I'm doing a Menopur cycle?
Good question. Okay, so Menopur is a combination of FSH, or follicle stimulating hormone, and LH, which is luteinizing hormone. And both of these hormones work in conjunction to stimulate the ovaries to produce multiple follicles and help those eggs reach maturity. The Menopur is given very widely. However, some cycles are going to be pure FSH and no Menopur in that cycle. So it's very important that you listen to your provider and your nurse, and you just follow their instructions on which one you give. The FSH and the Menopur do exactly the same thing. They stimulate the ovaries to produce multiple follicles so you can have a successful IVF cycle. Or if you're taking them for an IUI cycle, you would want to stimulate 1 or 2 follicles to reach maturity. So both are good. Both work the same way, and they're both fine. One thing to know about IVF and about IUI cycles is that there's no one exact way to get the job done. You can use FSH alone. You can use FSH in combination with a Menopur. You can use Menopur alone. There's no one right answer, and every clinic and every provider is going to do it maybe a little bit differently than maybe the person at the next clinic. And there's no exact right way. So we're going to just help you with how to get this shot done, tell you about why it's used, and then you'll go back to your clinic to ask questions about your dosage and your timing.
That's definitely, and that's a big thing that comes up quite often in these programs, is that we are here to be your safety net and to make sure that we can answer these questions so that you feel by the moment that you're about to inject yourself with your medication or put on a patch or whatever you're using, that you've been able to ask all the questions that you need about the big picture of why you're using it, all the way down to the small picture of how do you exactly inject and where and whatever and so forth. But the reasons why you're on one medication versus the other are always great to bring right back to your clinic, bring it back to the nurse, bring it back to the doctor, and they'll be more than happy. Just as Laurel's sharing all of this great information today, they'll be very happy to tell you why they did this for you versus what you may have seen, from a friend or on a blog or something like that. So hopefully that really helps people, is you have a couple of different opportunities and options on where to get that information. So thank you so much, Laurel. I appreciate that. Mm-hmm. And so this, again, a little bit more specific, and because you had talked a little bit about the Q-cap when you were walking through how that works and why people use it. And this question does come in quite a bit. And I'm not always entirely sure why people don't necessarily think they want to use the Q-cap, but the question keeps coming in, that is, what happens if I choose not to use the Q-cap? Will it affect the process? Am I doing things wrong if I don't use it?
All right. So the Q-cap is just a really nifty device. It's a needleless system. It has this little puncture thing here, but you can't hurt yourself with it. So it is really a great way to mix Menopur. I don't know why you wouldn't want to use it, but if for some reason you don't like it, you can ask your clinic. You can mix Menopur with a needle. That's not a problem. It's just a little bit more cumbersome to use a needle. But if you want to, then just ask your clinic and they'll be happy to provide you with the supplies.
Perfect. Thank you very much. Yeah, it is definitely there for a reason. It does make it a lot easier, so it's great. I think people just want to know why some products have something and some products don't. Everything's a little bit different, but thank you so much for answering that and for sharing, your perception on it and how you talk about it with patients. Yeah. So it does seem that as of right now, we're all caught up on questions. And like I like to remind people every single time, if you miss it and we move on to the next product, we are not just going to say, sorry, we're here and we are answering questions the whole night. So we will give you time. You can come back and ask your Menopur questions even once we do move on. And if you are right now, you're just furiously typing because you just thought of a question, we're not going to move on yet. I'm going to kick it back to Laurel just for another minute while we give people 30 seconds if they're trying to type something in before we move on to the next question. If there's anything you'd like to wrap up on the Menopur side before we see if anything comes in or we're ready to move on.
Okay. So Menopur, I think nobody asked about side effects. And I think it's really important to know about what potential side effects to expect with Menopur. Obviously, you could get a bruise at the site and you don't want to inject into a bruise from a previous shot. So be careful about that. And bruising is pretty common. Other side effects that you might experience would be kind of moodiness. Maybe you're going to have some tears that you don't really have a reason for. And that's because you've got a lot of hormones. The Menopur stimulates the ovaries to get big and to produce a lot of estrogen. So you have a lot of estrogen floating around your bloodstream, and that's going to exacerbate your moods. You're going to get bloating and tenderness in your pelvis. As your ovaries get big, they get heavy, and they are held in place in your pelvic cavity by a ligament. And it pulls on that ligament. And so you feel like you're carrying a couple of rocks around in your pelvis. So that's something very, very normal to be expected. Now, if you have some extreme side effects like ovarian hyperstimulation syndrome, you would have things like nausea, vomiting, extreme pain, and extreme bloating. And those are the kinds of things that you'd want to call your clinic for right away. But those are very rare. So I just wanted to touch on the side effects of Menopur because I know that it's important to know what to expect, what's normal. So I hope that relieves your anxiety about Menopur. Anything else, Craig?
Now, it looks like as of right now, we are all caught up with questions. So again, if people think about, sometimes people will hear a question about another product and it reminds them of, oh, I'd like to ask that about the earlier product. Feel free to definitely do that. But in the meantime, we are all ready to go ahead and kick it over to the next product.
Okay. So the next product is, sorry, is it HCG? Yeah, HCG. Hi, my name is Laurel, and today I'm going to be showing you how to mix and give your HCG trigger shot. HCG comes in 10,000 or 5,000 units, and your clinic will tell you how much to give. It typically will come in 10,000, and that's what I'm going to show you today. So to start, you're going to have your powder, your liquid for mixing, your needle and syringe combination, and then if you're told to give it subcutaneous, you'll have a little needle that you're going to switch it to before you give it. So to start, you'll take the caps off of your powder and your liquid. And you will take your syringe and needle out. And we typically tell you to mix it with 1 cc. So you're going to put 1 cc of air in the syringe first. And then before you do any of the mixing, you always want to alcohol the top of your vials for safety. You'll pull the cap off and you'll put this straight into the circle in the middle of the liquid. Push the air in, turn it upside down, invert it, and then you're going to pull back till you have 1 cc of liquid. Now, if you can see the needle in the liquid, then you know you're in the right spot. So pull back on the needle until you can see that tip in the liquid. If you go too far, that's good. You're just going to push the extra air back into the vial until you're at the 1. Reinvert, take it out. Now this liquid is going to go into the powder. Push it all in. Pull your needle out. And to recap, you're going to want to just slide the needle into the cap on the counter. That's the safest way, so you don't poke yourself. This liquid is no longer needed. This is your gold. This is what you're going to give. So just swirl it around a little until it's mixed. You want it to be clear again. And then you're going to do the same thing. You're going to put 1 cc of air in your syringe, put the needle in, invert it, and pull back until the tip is as low as you can get it. So you can pull all of that liquid into the syringe. Push the air in and pull the liquid back into the syringe. Get as much as you can. And if you have a large bubble at the bottom, you can flick it to the surface. And you want to push the air out. Now, if you're giving this intramuscularly, then you're going to want a friend to give it. And this is the site, either the left or the right hip, where these X's are. If you're going to give it subcutaneous, you're going to need to switch the needle. So if it's IM, you're ready to give it. And we'll go through that, and then we'll show you how to do the sub-Q shot. So the IM shot, you're going to have your friend or your partner give you a good pinch in the hip, and you want to pinch super hard because that's going to trick the skin into not feeling the poke. So just pinch real hard, poke straight in, all the way to the hub, let go, inject the medication, wait 3 seconds, pull out, and hold firmly on the skin surface. That's going to stop the bleeding and the medicine from leaking out. After about 30 seconds, check the site. If it's bleeding or leaking medicine, keep holding it until it's dry, and then you're done. To give a subcutaneous shot, you're going to need, I wasn't recapping that correctly. So slide it on the counter, recap, twist it off, and then you're going to get your subcutaneous needle. It's a little 1/2-inch needle. Twist that on. Take the cap off. And then this shot is given in the abdomen. You can pick a spot
anywhere you'd like, as long as there's no bruise. You want to stay about an inch away from the belly button. Squeeze, inject straight in, let go of the squeeze, and inject. Inject the whole medication, wait 3 seconds, pull out, and hold. If after 3 seconds, no bleeding or medicine leaking out, you're done. This will go in the sharps container along with all of your other glass. All done.
All right. Any questions about HCG?
Yes, we do have some questions coming in. So the first one is just about the different possible HCGs that you can take. And I know this comes up a little bit. People get a little confused on why this versus that. And we'll try not to get into the weeds on what your doctor or nurse chose for you. But the question comes in that says, are Pregnol and Ovidrel interchangeable? Is there a difference in how they work? Why would I use one versus the other?
Got it. Okay, so HCG is made by different manufacturers. Pregnol and Ovidrel are just 2 different brand names of the same medication. It's human chorionic gonadotropin. It's used as a trigger shot, and there's no difference. So it doesn't matter which one you're prescribed. They're interchangeable completely.
Perfect. Thank you very much. And I know part of it is we're just trying to put people at ease. So feel free to ask any of these questions to make sure that you understand why you're on your medication, what it's doing, and how to use it. So speaking of how to use it and what is it doing, the question comes in, how does HCG actually just work within my cycle, just top line?
Right. So HCG is called your trigger shot. And what this means is that it's given at a specific time, and it begins the final maturation of the eggs. So if you can imagine your ovaries are like a cluster of grapes, and every follicle is a fluid-filled sac, and when they are at the mature size, every follicle is approximately 15 to 20 millimeters in diameter. They're fluid-filled sacs, and there's a microscopic egg that's stuck on the inner wall of almost every follicle. And so what the trigger shot does is it loosens the eggs from the inner follicle wall so that the microscopic eggs are free floating in the fluid. And they're ready so that when you have the egg retrieval, the needle is inserted into each follicle and the fluid is drained, goes down the tubing and into the test tube and is handed over to the lab. And the egg travels with the fluid into the test tube. And that's what you want for a successful egg retrieval. So the trigger shot, the HCG, generally takes about 36 hours to do its job. So your clinic is going to tell you an exact time to take this shot, approximately 36 hours before your scheduled egg retrieval. So as an example, if your egg retrieval is scheduled at 8 a.m. on a Wednesday, then Monday night at 8 p.m., you'll have to take your HCG. And just follow your clinic's instructions on the time to take it. It might not be exactly 36 hours, but it is very important that you give it at the time they tell you. I recommend that you set your cell phone alarm for about 10 minutes prior so that you can have time to prepare it. And then you're ready to go to give that shot within 5 minutes of the time that your clinic has instructed.
Awesome. That's actually a great answer because it ties into another question that you gave a little bit of information right there that could be answering this question, but we might as well just kind of cover it all together. And the question is, how much wiggle room do I have with the exact timing of the shot? I know you just said about 5 minutes is the goal, yeah. But the question here is, if I miss the time, is my entire cycle shot? And I assume that was with no pun intended, but just like to know a little bit more about that timing, which we know comes up every single time. People want to know.
Okay, so if you forget to give your shot on time, give it as soon as you remember and call your clinic. Maybe they're closed already, so you just have to leave a message, but just make sure that you notify them the exact time that you did take it. They will take that into consideration. They may need to move your egg retrieval time just a little bit to take into account that extra time that you took it late. If you take it too early, same thing. Just tell the clinic. That's the most important thing, is to have that open communication with you in the clinic. It doesn't mean that your whole cycle is shot. It just means that things might need to be adjusted a little bit. And I would think that your clinic would do everything they could to do that for you.
Perfect. Thank you. And I know that's one thing too, that people, if you do potentially miss it, it always comes up. And I think the best part that we can share is, like you said, there is some wiggle room there. There is the ability, as long as you let your clinic know that something changed, you can try to figure it out and they may be able to do something for you. So it's not 100% definitely shot, but it's good to know this stuff in advance. And back to your point about setting the alarm, I always like to say now, between our phones and our watches and our smart devices, you probably have 10 things laying around the house that can remind you if one of them is not your significant other or a friend. There's plenty of electronics as well. So right. you have many different options, and there's a reason why your nurse gives you the time that they tell you. So try to stick to it, but also be aware that you do have some options if things get a little, they get away from you sometimes, and especially this time of year. I know it gets away from me all the time. So thank you so much, Laurel, for that.
Sure.
So now, this one's just a little bit more about presentation. And so the question is, if I have a large pill, or it looks like a pill instead of the powder inside, how can I be sure that it's going to dissolve correctly? Is there something wrong with my medication? Do I need to have it replaced?
So it just depends on which one you're using, either Pregnol or Ovidrel. They do look different. One comes with a small amount of powder. The other one looks like more like a lot of powder in a pressed tablet form. They're both the same amount. They're both 10,000 units or 5,000 units, whatever the bottle says. They're just prepared a little bit differently. So there's nothing to be concerned about. Just follow your clinic's instructions as far as how to mix it, and you'll be all set.
Perfect. All right. Sounds good. So let's just take one quick look. Okay. It does look like, as of right now, we are all caught up with those questions. So again, people, feel free if you want to get into the Q&A or the chat on the Zoom side, or just right into the chat itself on Facebook. We'll get to everybody's question, but just like we always do, we will give you another 30 seconds or so to type in your question. If you have one, I will throw it back to you, Laurel, if there's anything that you wanted to share.
Okay. I don't think I have much. HCG is given IM typically, but it also can be given sub-Q, as you saw in the video. The IM shot can be given upper outer quadrant of your hips. Just remember that you want to put all of the weight off of the side that you're receiving the shot. So if you're standing, just stand with all of your weight on the opposite leg from the side you're receiving the shot. That works really well. I think that's all I had to add.
Perfect. No, that's great. Those are the pro tips that people are looking for, is how can you make it a little bit easier? So sometimes we don't always know the questions that we want to know the answer to, but that's what Laurel's here for, because she gets these questions all the time. So she knows things that, maybe you're not even thinking about those questions sitting at home, but she's able to just say, hey, let me get out ahead of this and let you know, because it's something that you may want to know later. So thank you so much for that. We appreciate it. With that being said, looks like we're all wrapped up with questions for right now. So okay. Again, we can move on to the next product whenever you are ready.
All right. So the next product is Ovidrel. This is also a trigger shot, very much like HCG.
Hi, my name is Laurel, and today I'm going to show you how to inject the Ovidrel trigger shot. The Ovidrel trigger shot is used to stimulate the final maturation of the eggs in preparation for the egg retrieval. What happens is you give this shot approximately 36 hours prior to the egg retrieval, and it will stimulate the eggs to loosen from the inner follicle wall, so your egg retrieval can be successful. Please make sure that you take this shot at the exact time that your clinic tells you to. So to give this shot, you're going to take it out of the box. It comes in a pre-filled syringe, so it's super simple. You just point it toward the ceiling, give it a few flicks, take off the top, and then you want to get rid of that air that's at the top. So you're going to push on the plunger, and you're going to get rid of the air until you see a little drip of liquid at the tip, like that. Now to give the shot, you want to pick a spot in your abdomen, And you can pick any spot you'd like, as long as it's at least an inch away from the belly button. And there's some fatty tissue to squeeze. So this is going to be my abdomen for the demonstration. And what I'm going to do is just give it a good pinch and hold it at a 90-degree angle. I'm going to go in quickly like a dart, let go of the pinch, and then I'm going to inject the medication. Once the medication is completely given, you want to wait about 3 seconds. Take a Kleenex, pull out quickly, and hold your skin with the Kleenex. After about 10 or 15 seconds, you'll check your skin. If it's dry and not bleeding, you're done. If you do see some liquid, or if it's bleeding, you're going to hold it a little bit longer. Recheck it. It's dry, then you're all done. Now to get rid of this, you're just going to drop it straight into your sharps container without recapping. And that's all there is to it.
Any questions, Craig, on Ovidrel?
Yes, actually, there are a couple coming in right now. So this is, I guess, just a little bit on, you touched on a little bit, but what's the difference between Ovidrel and those HCG products that we just talked about in the last demo? Why one over the other?
Yeah, good question. It's really up to your provider on which one they order for you. They do the exact same thing. Ovidrel is chorionic gonadotropin, and it is a trigger shot. So it works the same. You want to give it approximately 36 hours prior to the egg retrieval, or you can give it prior to an IUI as well to ensure ovulation. But it really is up to your clinic on which one that they order for you.
Great. Thank you so much. Yeah, it can be a little confusing because there's a lot of products involved and a lot of different presentations of some of these different products. So it's always good to really understand why you're on one versus the other. And sometimes if you really have a question on why your physician chose one versus the other, that's a great question just to ask the clinic when you go back in, or when you're on the phone with them to find out, and they'll have an answer for you, and that'll be a great way to find out why you're using one cycle versus the cycle that you heard a friend of yours or a colleague or a coworker or something like that did. So thank you so much for answering that. This one just very, very specific, just wants to know, how do I store my Ovidrel? Oh,
yeah. Just a little aside from that last question before I answer this question. A lot of patients are going to use what's called Lupron for their trigger, and we're not talking about that tonight, but it is a very common trigger, and it's used for patients that may have a higher than average risk of getting ovarian hyperstimulation syndrome. When you use a Lupron trigger, you typically will give HCG with it, and you only need a little bit of HCG. So that is one reason why HCG is used over Ovidrel, because you can limit the amount of it that you are taking and use it in conjunction with Lupron. So I just wanted to put that out there. That is just one reason why one would be used over the other. As far as how to store Ovidrel, it is kept in the refrigerator. So very simple. Just take it out right before you're going to give it.
Sounds good. Thank you. And thanks for clarifying the original question as well. I think those are the things that are helpful to people to really understand the differences between them. Okay, so you mentioned bubbles and kind of the tapping to get rid of them. And this question almost invariably comes in every single time because people have watched enough movies or, daytime TV where this becomes an issue. And why aren't bubbles in my syringe actually an issue? I thought it could cause a major problem if I don't get the bubbles out before I inject into myself.
Okay, so little bubbles, not a problem. I know you've heard things about bubbles causing problems in your veins and that kind of thing, and movies give them a bad rap, but little bubbles are not a problem at all. I would tap the syringe and get rid of the majority of air. If there's a large amount in the syringe, get that out of there before you give it. But little ones on the side walls and stuff don't matter at all.
Yeah, definitely don't get your medical advice from a movie, probably. That's probably for the best. So hopefully we can put that one to bed so people aren't worried about that. But it's good. Again, these are why you ask these questions now, because you want to know now and not be worried about something right at the last minute and you don't have somebody to ask and you're not sure where to go, that's what PharmAssist is all about, is how can we answer those questions for you right now. So looks like as of right now, we are all caught up with questions on Ovidrel. So what I'll do is we'll say any questions for any of the 3 products we discussed or something tangentially related to them, feel free to bring that up right now. We can give another 30 seconds to a minute if people are trying to type questions. But in the meantime, I will throw it back to you, Laurel, as we start getting ready to wrap up the program tonight.
All right. Well, I just want to thank everyone for coming. And if you still have a question you want to type in, be happy to answer it. I hope that this gives you a little more confidence to give your shots. I know that it can be pretty daunting. And once you get going with them, you'll find that it's not nearly as hard or as painful as you can imagine. If you find that your shot is stinging, just give it a little more slowly than you're giving it, and that should help. You can ice the site before you give the shot. That helps too. And you can use something like Emla cream or Cinera patch, which is a numbing patch, before you give your shot too, if you'd like. That's another option. So any other questions, Craig?
I think we are all good. We've gotten through pretty much all the questions that came in. So it's a perfect time for us to start to say goodbye to everybody. And then in the meantime, if something pops in, I will let you know.
Okay. All right. So remember, you can always access these videos at mymandels.com, mymandelsPharmacy.com. You can access them on YouTube and Facebook. And if you want, you can just go to YouTube and you can type in the name of the medication and Mendel's Pharmacy, and you've got a variety of healthcare professionals videos that are available to you, and you can just watch whatever medication you want. So thank you for your time, and remember to stay positive, keep the faith. You are going to build your family. Thank you.
Thank you, Laurel, so much. I just want to say thank you so much for your time and your expertise tonight. You did a wonderful job as always, and you were able to answer all these great questions and share a little bit about yourself as well. And I think a big part of the PharmAssist program is, yes, we want people to feel comfortable knowing that, that they understand and have asked their questions and got answers, but also knowing that there's other people going through this, that you're not alone in this. There are places you can reach out to if it's not just your HCP, which is a great opportunity to reach out to them, but you also have your pharmacy. So Mandel's, you can reach out to us. You can reach out to other nurses. You can find out. Now, obviously, you can talk to patients, and that's really our goal here, is to bring everybody together. So I want to thank everyone who joined us via Zoom and Facebook Live tonight, and for sharing all those great questions. You really got some excellent answers, and we hope you were able to learn something tonight. And not to forget, one of the key things is, as we heard earlier, that all of these full virtual learning experiences, or VLEs as we like to call them, as well as the individual product demonstrations, are available on demand on YouTube, Facebook page, and as you mentioned, mymandelsPharmacy.com/PharmAssist. And that is where you can watch the entire video, where you get to see the Q&A and everything, or you can just say, I want to get a quick refresher on my Menopur, so I just want to watch that, a couple-minute video. They're all available for you, however you think works best for you. We definitely look forward to seeing everybody here again next Monday night at 7 p.m. Eastern Standard Time for another excellent program. And one of the most important things I can say in 2020, one of the best ways to get this information out to other people is share, share, share. If you have a friend, if you have a family member, a colleague, a coworker, somebody else who's going through this, and you think maybe they don't have access to the same, the same type of, question and answer that we have right here, then this is a great way to share this program. Let them know about the PharmAssist program. Give them the login information so they can hop on and get some questions answered as well. So thank you so much. I want to say thank you again, Laurel. You did an amazing job. I'm so glad to have you on here. We're blessed to have you as part of the program. And most importantly, I just want to say to everybody, enjoy what's going on out there. Enjoy the holidays. Happy holidays. And we will see you again right here next Monday night at 7 p.m. Eastern Standard Time for the PharmAssist program. Have a great night, everybody. Bye-bye.
Bye.